Can you make the diagnosis? A patient 2 months post myocardial infarction presents with congestive heart failure and persistent ST elevations and deep Q waves on ECG. What is the likely diagnosis? A. Dressler syndrome. B. Left ventricular hypertrophy. C. Myocarditis. D. Ventricular aneurysm. Answer is D. Ventricular aneurysm. Can you make the diagnosis? A young non-smoker presents with difficulty breathing, pulsus paradoxus, and a normal cardiac exam. What is the likely diagnosis? A. Pulmonary embolism. B. Chronic obstructive pulmonary disease, COPD. C. Pericardial effusion. D. Asthma. Answer is D. Asthma. Can you make the diagnosis? A patient on day 3 post-myocardial infarction presents with pleuritic chest pain that improves when leaning forward with clear lungs on auscultation. What is the likely diagnosis? A. Dressler syndrome. B. Pneumothorax. C. Acute coronary syndrome. D. Peri-infarction, pericarditis. Answer is D. Peri-infarction, pericarditis. Can you make the diagnosis? A patient on post-myocardial infarction, day 5, presents with acute onset chest pain and profound shock without signs of congestive heart failure. What is the likely diagnosis? A. Dressler syndrome. B. Pulmonary embolism. C. Acute aortic dissection. D. Ventricular free wall rupture. Answer is D. Ventricular free wall rupture. Can you make the diagnosis? A patient with a recent upper respiratory tract infection presents with congestive heart failure and dilated ventricles with diffuse hypokinesia on echocardiogram. What is the likely diagnosis? A. Dilated cardiomyopathy. B. Viral pericarditis. C. Ischemic cardiomyopathy. D. Takotsubo cardiomyopathy. Answer is A. Dilated cardiomyopathy. Can you make the diagnosis? A chronic renal failure patient presents with pleuritic chest pain that improves when leaning forward. What is the likely diagnosis? A. Uremic pericarditis. B. Acute coronary syndrome. C. Pleurisy. D. Pneumonia. Answer is A. Uremic pericarditis. Can you make the diagnosis? A male smoker with chest discomfort and the chest X-ray findings of widened mediastinum. What is the likely diagnosis? A. Pulmonary embolism. B. Pneumothorax. C. Lung cancer. D. Thoracic aortic aneurysm. Answer is D. Thoracic aortic aneurysm. Can you make the diagnosis? A male with a history of systemic lupus erythematosus presents with epigastric burning provoked by exertion and relieved by rest. What is the likely diagnosis? A. Gastroesophageal reflux disease, GERD. B. Peptic ulcer disease, PUD. C. Esophageal spasm. D. Atypical angina. Answer is D. Atypical angina. Can you make the diagnosis? A patient presents with upper extremity hypertension, brachial femoral pulse delay, and a continuous interscapular murmur. What is the likely diagnosis? A. Patent ductus arteriosus. B. Aortic dissection. C. Corctation of the aorta. D. Subclavian artery stenosis. Answer is C. Coarctation of the aorta. Can you make the diagnosis? A young patient with hypertension and palpable bilateral, non-tender upper abdominal masses on physical exam. What is the likely diagnosis? A. Renal cell carcinoma. B. Renal artery stenosis. C. Autosomal dominant, PKD. D. Nephrolithiasis. Answer is C. Autosomal dominant, PKD. Can you make the diagnosis? A patient with Marfan syndrome presents with a sudden onset tearing chest pain. What is the likely diagnosis? A. Acute myocardial infarction. B. Pulmonary embolism. C. Esophageal rupture. D. Aortic dissection. Answer is D. Aortic dissection. Can you make the diagnosis? A patient presents with hypotension, distended neck veins, and muffled heart sounds. What is the likely diagnosis? A. Cardiac tamponade. B. Tension, pneumothorax. C. Acute myocardial infarction. D. Pulmonary embolism. Answer is A. Cardiac tamponade. Can you make the diagnosis? A patient with sharp, localized chest pain that is worsened with inspiration and tender to palpation. What is the likely diagnosis? A. Myocardial infarction. B. Pleurisy. C. Pneumothorax. D. Costochondritis. Answer is D. Costochondritis. Can you make the diagnosis? A patient with a recent upper respiratory tract infection presents with syncope, dyspnea, and electrical alterans on ECG. What is the likely diagnosis? A. Acute myocardial infarction. B. Pericardial effusion. C. Pulmonary embolism. D. Pneumothorax. Answer is B, pericardial effusion. Can you make the diagnosis? A patient status post-coronary angiogram presents with abdominal pain, acute kidney injury, eosinophilia, and purple mottling of both feet. What is the likely diagnosis? A. Cholesterol embolism. B. Acute pancreatitis. C. Contrast-induced nephropathy. D. Peripheral artery disease. Answer is A. Cholesterol embolism.